Hi, I'm Dr. Mark Lewinter, licensed acupuncturist at Metro Acupuncture in Atlanta, Georgia.
And I'm Dr. Andrea Lewinter. I'm also an acupuncturist at Metro Acupuncture in Atlanta, Georgia.
All right, Mom, are you excited about today's topic?
I'm very excited because I think today's topic is going to expand into many other things. Do you want to share with our audience what our topic is going to be today?
I sure do. Today's topic is talking about headaches and migraines during pregnancy.
And that happens to so many of our patients. They'll come in
Yeah,
with,
I was looking at a statistic, and I believe that about a third of women experience headache or migraines during pregnancy. It can be a very common thing, and I love treating headaches. One of the reasons why I love treating headaches is because I really enjoy helping people feel better. And acupuncture can be helpful for many things. I found that headaches and migraines is one of the things that's on the top of the list that acupuncture can be helpful for. I can only imagine if someone's experiencing headaches, migraines, and they're pregnant and it's interfering with their quality of life, they may feel really limited in what they can do. And some of the tools that they used in the past might not be able to be used when they're pregnant.
exactly, because many women who do have chronic migraines or chronic headaches before they get pregnant can no longer take their medication. You know,
Absolutely.
it's one of those things that they're put in a very difficult situation, and anything that can give them relief is a bonus.
For sure. And it can be something that can be added in during a pregnancy, whether it
Mhm.
be the first
Mhm.
trimester, second trimester, even third trimester. You mentioned patients who have a history of headaches and migraines, and they're not able to take their medicines. I think that for those patients, starting acupuncture early in their pregnancy can be most helpful. But there are also patients who maybe never had any issues with headaches or migraines. But because of their pregnancy, the hormonal changes, the changes with blood volume, the stress of a pregnancy, sinus congestion, a headache or migraine can become a frequent problem. And they may be looking for natural solutions. And acupuncture is one that works very well.
It sure does. That's been my experience as well.
I've been able to treat patients who have a history of a prior pregnancy where they had headaches, migraines throughout the entire pregnancy. And when they add in acupuncture to their next pregnancy, they do better than ever before. And this is
Mhm.
very rewarding for me because they may have been thinking about the pregnancy in terms of how their last one was and dreading the pregnancy because they know they were suffering for weeks, sometimes months. And to be able to have a different experience during a pregnancy when I'm able to do acupuncture and they're able to feel better, not have the headaches and migraines is so rewarding for me.
Yes, it is. But it makes such a difference in the person's life as well because they are bringing life into this world. And the energetic of the mother, if she's constantly under stress, those hormones are also being transmitted to the fetus. If we can really address the mother's comfort, it has long-term effects for the next generation as well.
Absolutely. And because of the points that I have found to be most helpful to use during a pregnancy, this treatment can be done in the first trimester, second trimester, even into the third trimester, because the points that I've found to be most helpful are points that are on the back.
Mhm. Mhm.
And these points classically have been used based on the principles of East Asian medicine to support yin. And what is yin? Yin can be many things. We can pair that with yin and yang. Yin can be soft. Yin can be nighttime. Yin can be ease, relaxation, female, rest, where yang is action, male, movement, maybe something that's more hard versus soft. To work with yin during this time can be very helpful.
And in Asian medicine, the back is considered yang because it faces the sun. It faces the heavens. So it's considered yang. And very often, at least this has been my experience, is that there's excess energy in the body, particularly during pregnancy. And these points that are defined on the back are moving the water element throughout the whole body. So if anything is too much, it's going to allow it to release. And they're also connecting to all the yin organs. So again, doing this point, you're stimulating the action of the yin organ itself, which is the lungs, the heart, the liver, the spleen, the kidneys. So I think that it's a wonderful treatment at any time, particularly when you're pregnant. There's just so much, what is often referred to as heat, but friction, that friction that's in the body, and being able to release that in a gentle, nurturing way.
Yeah, the growth process is a very yang type of thing. You
Mhm.
also the body expands. That's a yang type of thing. There's simply can be excitement about a pregnancy. That's a yang kind of thing. There can be worry and stress. It's a yang thing.
Mhm.
So to work with the yin can be very helpful. I also wanted to answer the question, how long will it take for me to get better? And I find that the acupuncture works pretty quickly when it comes to treating headaches and migraines during pregnancy. Generally will see my patients once a week for a few weeks, maybe 4 to 6 times. And during that time, they'll experience a decrease in the frequency, intensity, and duration of the migraines. And then after we get them to a place where they are feeling better, we decide if we're going to add some more space in between the treatments. That may be seeing them once every other week or once a month. Some people want to continue with once a week during their entire pregnancy. And to be able to be part of this exciting, significant time in someone's life really is an honor.
Yes, it is. It is. So, do you do any other treatments for migraines or headaches, or is that sort of your standard?
When my patients are pregnant, I've found these points are the foundation. I do sometimes customize the treatment a little bit if needed, but I love that this treatment can be used throughout the entire pregnancy.
Yes, they're all very safe points.
Yeah. Yeah.
Yeah. That's what I hear from a lot of patients is it is safe. Is it safe to do? And all the points are very safe to use throughout a pregnancy.
Yeah, I have the patients lay comfortably on their side.
Mhm.
Often they'll place a pillow between their knees. Some people like a little kind of pillow to cuddle, so it creates like a body pillow situation. And whether they're laying on their left side or right side, most people tend to lay on their left side. But I think that being comfortable during an acupuncture treatment is really important, and
Yes.
being comfortable as one enters into their second and third trimester is also extremely important.
Yes.
Yeah.
Yes.
It's this wonderful thing that we can offer. It's natural, it's safe, it can help one feel better. What else would you like to say about acupuncture for headaches during pregnancy?
I think that
Headaches and migraines, sorry.
yeah, I think that so much of what you said, I will just be repeating, but it is a hormone driven sort of symptom. Now, can it be other things? Yes, it can be lack of fluid, it can be fatigue, it can be digestive issues. Can
Like a blood sugar, if
can
someone's not
be.
feeling well, they may not be eating as
I
much.
mean, eating.
Yeah.
Yeah.
Oh,
So,
caffeine withdrawal. I don't know if I already said that.
and a lot of people, or many people, I shouldn't say a lot of, but many people during pregnancy will stop drinking caffeine. They may do it before they get pregnant, but once they find out they're pregnant, they may do it very abruptly. And sometimes it takes 3 or 4 days or a week for the body to recalibrate. And while it's recalibrating with from the caffeine, it now is pregnant, and we've got surges of estrogen and progesterone and many other hormones that are involved in pregnancy surging through the body. So it can be a lot of different things. Again, that we can't discount the fact that, yes, for many people, pregnancy is a welcome event. And even being a very welcome event, there's a level of stress and uncertainty, and the body doesn't like that. It's not interpreting that stress as, oh, great, we're going to have a baby stress.
Yeah.
No, just interprets it biochemically that the body is now putting out a lot of other chemicals that are creating havoc.
Yeah.
So,
A
so
lot. It's like a lot to think about. You bring a child into the world. Well, you may already have a bedroom set up for the child. You may already be planning this. It might be a surprise. The whole experience puts one in their head a lot. How are we going to tell our parents? Are our parents going to be excited? How is this going to affect our friends? So just thinking about it, I can imagine it's a headache just in planning it. Again, positive thing, exciting thing,
yeah.
a blessing, but it can be a headache.
Yeah, but the body doesn't interpret good or bad. It only interprets the chemistry that is present at that particular time. So yeah, we have to give ourselves a lot of grace, a lot of compassion while we're going through these things.
Yeah,
And recognizing that, yeah, this may be part of the whole process. I
and
love what you said about women that have had previous pregnancies and experienced sinus issues and headaches and so on. And we see that frequently in the treatment room is a woman will come in and say, I had in my last pregnancy, I had this headache all the way through. And after really just a few treatments, they're saying, I'm feeling better. God, will this continue? Because there's that hope, there's that I won't have to be in pain throughout the next 25 weeks or
that's
so.
right. Yeah, yeah. And sometimes it can even be longer than 25 weeks, especially if the headaches start within,
Early.
yeah, early. So we talked about some of the reasons why headaches and migraines can occur, whether it be just be history or the pregnancy itself. And experiencing acupuncture can really show you the effect. So if you're pregnant and experiencing headaches or migraines, or headaches and migraines, and you're in the Atlanta area, come and see us. For over 20 years, we've been treating patients who have been diagnosed with infertility, and many of those patients will get pregnant. And we love continuing their care during their pregnancy, whether it be headaches, migraines, or something else. I'm excited. Next time, Mom, we're going to talk about sinus congestion during a pregnancy and how acupuncture can be helpful for that. So that'll be a lot of fun. But you can schedule your acupuncture appointment at metroacupuncture.com. And we look forward to seeing you in person and helping you feel better.
Thank you for listening.
Thank you.